stronger, more vibrant economy.
This is a more open-ended discussion about health care with Jill Stein and Rocky Anderson. Dr. Jill Stein, why don't you begin?
Yeah, so first I just want to reiterate in answer to that discussion that the Affordable Care Act in Massachusetts has not brought down premiums. It has not reduced the rate of health care inflation. And that's one of the very critical reasons why we do need to move to a Medicare for All system. And to just reiterate that under the current privatized health insurance system, we're spending 30% of every health care dollar is not going to health care. It's going to paper pushing and bureaucracy and red tape. Under a Medicare for All system, that 30% of bureaucracy shrinks down to just 2 or 3%. That's how come it doesn't cost us anything more to actually cover everyone and to cover everyone comprehensively. And something else kicks in, which is that under a private system, you have this massive medical inflation. So the price of health care goes up much faster than inflation in the general economy. But under Medicare for All, that inflation goes away. So that is what actually saves us trillions of dollars over the coming decade. But I want to just quickly introduce one other idea, which is that we not only need to change the insurance system, we need to fundamentally change the focus of health care, because right now we have a sick care system, not a health care system. We need to actually address the drivers of chronic disease in our communities. 75% of our health care dollars, and that's $2.2 trillion a year if you add up private, out-of-pocket, business, and government expenses. It's a huge amount of money, $2.2 trillion. And it turns out 75% of those dollars are actually being spent on the treatment of chronic diseases that are preventable at a tiny fraction of the cost. How do we deal with that upstream? Basically by creating an infrastructure for health, by creating healthy communities. That means a healthy, local, sustainable food supply, not this agribusiness, refined corn, soy, high-calorie, nutrient-poor food. Instead, you have a nutrient-rich, local, organic food supply with lots of fresh fruits and vegetables, like what your mother always told you. It means having an active transportation system that would dovetail with transportation through a public transportation system. This is what we're calling for through the Green New Deal, that would create that relocalized, healthy, resilient food system, as well as creating a public transit system, including active transportation, bike paths, walking, and so on, as well as pollution prevention. And that's what the green economy does in getting us off of fossil fuels and dangerous nuclear power. So the Green New Deal turns out to provide not only for jobs, for jump-starting the economy, getting us off of dirty energy and making wars for oil obsolete, it also provides the basics of a healthcare system that can decompress this $2.2 trillion that we're spending every year, because if we've got health integrated into our communities, we can bring down 75% of that cost of healthcare. That's how you get to real prevention and cost savings in our health system.
Rocky Anderson.
There has been such a massive campaign of misinformation around the single-payer Medicare for All proposal. But even with that campaign, the vast majority of people have supported this kind of a medical system because of the tremendous successes these systems have seen all around the world. One of the things that we hear from people is, oh, you're talking about socialized medicine. It's not socialized medicine. If you're socializing anything, it's the insurance. Who's going to pay for it? Is it a company that spends millions upon millions of dollars every year with advertising and paying people that review claims so that they can try to deny them and jack everybody around? Is it the expense for the CEOs, the salespeople? You cut all of that out with a single payer, the government. And Jill's right. The experience has been that most countries that have single-payer system pay about 3 to 5% in administrative costs, rather than upwards of 15, 20, even more percent on administrative costs. So in terms of coverage, in terms of quality, in terms of the medical results, the cost control, and the choice, because you do get to choose your own medical provider under a single-payer system. These systems excel far beyond what we have in this country, whether it's our present system or once Obamacare is fully implemented. We all need to demand better of our elected officials, or we're never going to see this because of the corrupting influence of so much money coming from the pharmaceutical and the for-profit insurance companies.
This is Democracy Now!'s special coverage, expanding the debate of the presidential debate, the first. It's being held at the University of Denver. We are not far. We're going to go back to the debate moderator, Jim Lehrer.
The role of government. And